a bit later. So right now we want to get into the first discussion for the day, and this is all about the state of COVID-19 here in our country. Now, just looking at the global stats, Kenya still remains among the top 10 African countries that still report the highest caseloads of COVID-19. Just yesterday we had a total of 497 more cases. We had 16 deaths that were recorded, as well as 238 recoveries. But what is the way moving forward when it comes to COVID-19? Looking also at the fact that schools have reopened, we're now hearing cases of, yesterday there were 2 students that were reported that were in the dailies in Nandi and Kakamega. There were 2 non-teaching staff that were reported to have contracted COVID-19 in Nairobi. And just today in the headlines, you just got to hear of medics also having reported 217 more of them having contracted COVID-19 just in this month of October. What is the way forward? We have been seeing warnings from the ministry that, there could be a second wave of infections if we do not take control of how we are behaving. So what do we need to do to just make sure we don't get to that point? Well, that is the question we want to answer this morning. And to help us with this conversation, we have with us the Chief Administrative Secretary in the Ministry of Health, that is Dr. CAS Mwangangi. Karibu sana.
Thank you, Jane.
Thank you for being with us this morning.
Thank you for having us.
Absolutely. Now, let's just get straight into it. We have been seeing the CES telling us there is a looming, the potential of a second wave of infections. How close are we to crossing that line?
So the warning by the CS is a warning that needs to be taken seriously.
Yeah.
We have a team of experts within the Ministry of Health who have been plowing through the data. And the good news is that now we have almost, 8 months of data, and we're able to really, better predict, how the outcomes will look like for COVID-19. And the last interaction we had with this modeling team tells us that we are not going in the right direction, and that it may be that we are having a surge in cases. It may be that we are actually no longer adhering to the measures that we've put in place. And therefore, it becomes very important, and the CS did this, sound the alert to the people to remember to adhere to the 3 containment measures.
Yeah.
So when we look at our data, when we look at our numbers right now, our curve has started climbing, and that's not good.
Yeah. But before that, we had critics always saying that these numbers may not be real. Sometimes you're just cooking them up to scare us. And I know sometimes you had addressed this issue, but it's still a conversation and a voice that is still ringing very loudly among the population.
Yes. So what becomes important for people to understand, and we've often, as we design our communication strategy, we've often said, it would be important for Kenyans to realize that as we speak today, we have about 49 people in the ICU. In ICU admission for COVID-19. And there's no way we would, cook numbers, because, as people have said, you don't cook something that you're not going to eat. So the numbers are real. The facts are there. Remember, this is 8 months into the COVID-19 pandemic. We've already established community transmission, and the only weapon that would help us, stem down these numbers would be adherence to these measures. And so what we're seeing is a steady increase in ICU admission, a steady increase even in normal bed admission. We've actually seen a steeping, a climbing steep when it comes to the normal patients, the moderate cases, the moderate, to severe cases of COVID. We are seeing an increase in those numbers. And when we do, testing and random testing in the communities, what we can say is that there's possibly no area in the country where we do not have a COVID-19 case. Meaning we've completely established this disease in our communities, and it is there with us. And of course, then if you talk to the more than 800 families who've lost their loved ones, they can tell you that COVID is real. Those are not just numbers. 850-something people have passed on, not just numbers.
And in the event of a second surge of these infections, we get reports that it's going to be worse. The consequences are going to be more severe. Is this true?
So what we've seen, and remember, COVID is a new disease. When we look at different countries, the UK, when we look at Italy, Spain, France particularly, where the president was just a few weeks ago, all of those countries have reported that their second wave was a little bit more severe. And that's an interesting component of this disease as we try to understand the virus. One would think that, by the time we have a few months in, we'd have immunity in the community and we'd have some better protection. But that's not the story we're seeing, at least in those countries. And so because of that, we, of course, then as Kenya have to be on guard. We have to ensure that we are, 10 steps ahead of the disease. And that is why we are sounding the alarm. That is why we are here today, to really sound the alarm that we need to be careful, we need to adhere to these measures.
Now, let's talk a bit about our children. We are in that process. We're trying to reopen schools in phases. It's been about 3 weeks since we had the tertiary institutions and, secondary primary schools reopen. We are now reporting cases of this disease in schools. And previously there was this narrative of children being super spreaders. Is this still the case, and what are the consequences in the event that this now blows up in our schools?
So yes, Jane, you're quite right when it comes to the vulnerability of children, when it comes to them being super spreaders. And there's still emerging research that is coming out that is telling us children may actually not get the severe form of the disease. Children may actually somehow be able to sail through as asymptomatic cases, but they still pose a risk when it comes to them interacting in the different households and the people in the family. However, again, more research, and particularly from our organizations that deal with children and child health, like UNICEF, have told us that you really do have to balance the risks of having the children staying at home for a longer period of time vis-a-vis them going to school. And interesting data, has shown us that we actually have, more and more, should I say, the ill effects of children being home presenting themselves. For example, now we can see that issues that deal with hunger, issues that deal with emotional abuse, issues that deal with sexual abuse, gender-based violence, issues that even deal with teenage pregnancies are actually on the steep rise. And so what happens is, and even beyond such social issues, we start looking at the child and the economic development of the country. What are we losing when it comes to 6 months out of school in our children, and what will the effect of this be 10 years from now for the country, 5 years now from the country? And so it became a very important balancing point, and the Ministry of Education has really engaged with all stakeholders. We actually have a team of doctors who sit with them when they're making their decisions to be able to analyze and to determine when is the right time to open, who should go in first, and how should we phase this. And what I can say right now, and particularly in light of the current curve, is that right now we shall sustain it just at the, the class 4s and the 8s, the ones who are doing the exams, and leave it at that point as we analyze the situation to see what happens. Parents are concerned. We've had a lot of concern from different parents. The main thing that parents need to be aware of is it's those 3 measures. If our children go to school and they're able to mask in school, you're able to provide that mask for your child. And remember, we said for those that lack, we shall provide them a mask. But you're able to provide a mask for your child, and you're able to really talk to your child day in, day out, wash your hands. I've seen some, children, even in my family, who remind me, you need to wash your hands. You've not washed your hands, Mercy, what's going on? And so those are the things that, exactly, and yet you're here telling us to wash your hands. So that's what we need to inculcate in our children. And then, of course, we do appreciate, and this is not anything that we are blind to, that social distancing is hard. Social distancing is hard in schools. Social distancing is hard when children want to play together, when they want to share masks, when they want to share their breakfast or their meals and their snacks. But then what we need to do is just to remember that at the end of the day, this pandemic may be with us for 2 years or so. What are we going to do? So we have to learn to live with it. And we've particularly, been looking at interventions in other countries. A country like Japan just released what they're calling their new normal. And they've really sort of gone into their communities and told their people in Japan, this is the new normal. This is, we're in for the long haul. This is how we're going to live within this new normal. This is how we're going to mitigate the challenges of social distancing. This is how we're going to make it a good situation. It's not a good situation, but we have to make lemonade out of it.
To make the most out of it.
That's true.
Now, looking at the fact that we also saw the CS saying that if we continue with this trend that we are on, this path that we have chosen to go on as a country, whether knowingly or unknowingly, there might be more stringent measures being put in place. And some have been thinking, okay, is it another case of lockdown part 2, or what is it that the CS is really talking about? So what are some of these stringent measures that will be put in place in the event that we keep on this path?
So again, learning from different countries who've, traveled this journey before us. In the UK, for example, just 3 days ago, the area known as Wales has actually undergone, a form of lockdown. If you look at France, they've actually, dialed back in terms of social gatherings. They've continued to restrict numbers. They've continued to close bars, even close some restaurants. These are the measures, that we are talking about. Remember when the president made his last address, particularly when he discussed the point of inflection, which is the point where the curve starts tipping. He did say that nothing stops us from going back to increase these measures, particularly if we have to guard, against this disease in our population. And so the measures that are there are the ones that have been on the table, from the beginning, that we need to look at our social gatherings, we need to look at our churches, we need to have discussions with the Interfaith Council. Are we actually regulating our churches the way we should? Are people actually practicing hand washing before they get into the church? Do we have enough sanitizers available in the church? When it comes to, restaurants, are the restaurants actually adhering to those measures? If you remember at the beginning of the pandemic, restaurants were really spacing.
Yeah.
If we move around now to restaurants, we can see it's back to, close-knit tables. Are those measures being adhered to? If we get into the bars, I think we've had lots of complaints where people, because of, alcohol and the effects, sort of forget to social distance in the bars. So those are the things that we would have to come back and curtail and look at that. When you look at funerals, I'm informed last week by colleagues who have attended different funerals, some having more than 500 people.
Imagine.
While the restrictions were put at 100, do we have to then clamp back down to just 50 people in a funeral? So these are some of the considerations that are on the table, and we're glad because this is going to be guided by data. We are looking at the next 2 weeks. How does the situation look like? So that we can be able to determine what are those measures we have to put in place. But even as we discussed, Jane, I mean, it's curious because some people have asked, really, Kenyans, we just want you to wash your hands. We just want you to wear a mask. We just want you to observe physical distancing. Why should that be so hard? Why is that so difficult? Just those 3 measures that, if you notice, Jane, are all individual measures.
So is it a case of people forgetting to adhere to these guidelines, or just outright just disregarding them?
So what we've noticed, and we are working with some academic teams, and I recently did a little course with Strathmore University on behavior change communication, and what we've learned is that by natural human nature, that it gets to a point where there's fatigue when it comes to different interventions. However, interestingly, it also tells us that it also depends on, should I say, the cultural norms of a people, the adherence, discipline of a people. All these are factors that come into play. And so the important question here then becomes, what is government's role in ensuring that we're able to actually have our citizenry adhere to these measures? And of course, as government, we come in as regulators, we come in as enforcers, and we also come in as communicators, trying to really paint out the case for people that if we show you our curve today and when we draw our curve for you, you will see that these cases are increasing. I think compared to the beginning of the pandemic, there are more people now who you can talk to who can tell you, I've been positive, or I've met someone who's positive. So the cases are there. So as government, what we're looking at is, do we then, escalate our containment measures? Do we escalate some elements of enforcement? Because it's necessary, because we are duty bound to take care of the citizenry.
So could there still be a probability of a nationwide lockdown?
All things are on deck. All options are on the table right now. Yes.
Now, looking at institutions like prisons, it was pointed out that there are also more cases that are being reported in prisons, and places where social distancing is a hard reality. What is being done to such institutions?
So we're working with the prison department quite heavily. I think you would note about 2-3 weeks ago we actually had a restriction as to the number of inmates who can be brought in, and that's perhaps the biggest challenge that we're facing. When we look at prisons, when you look at refugee camps, anywhere where you have that congregation of people, it's a challenge. And really, of course, in such a setup, we would be talking about mainly the masking and the hand washing. There's no way you can, restrict people when they're in a room like this and they're there and they're incarcerated. So we've looked and we've discussed with the judiciary, we've discussed with the law enforcers, and tried to see what are the other ways in which you can, effect some form of cautionary measures. How can you have, different fines given as opposed to incarceration, so that we can reduce, the load within, alternative forms of justice and caution taking within that population. However, we do know that at the end of the day, there are those who do have to be incarcerated, and for those who are incarcerated, we've adopted again masking and hand washing within the prison. Again, remembering social responsibility. The prison warden will not go around ensuring that everyone is washing their hands. Again, it's really drumming that lesson, and that element of it really is you. It is all about you. You are the social vaccine. Yes.
Now, Community spread has also been on the rise, and more so in rural counties and areas. What has facilitated this? Is it a question of people moving around without, regarding the guidelines that have been put in place, or just the fact that, there isn't much awareness down at the grassroots as we thought was there?
So, I mean, that's an interesting question. I was listening to a colleague tell me about Bomet. He was there last week, and he tells me that in Bomet, few people are masking. People are not washing hands. And when he asks them what is happening here, most of them say, oh, I thought COVID, is done. I thought COVID is over. And the interesting thing is then it becomes important perhaps to ensure that we are drumming the message that the disease is still here. And we do take note of that as a Ministry of Health. And we're sending out teams, in terms of supervision and behavior change communication programs, using our community health workers to ensure that they send the message. However, it becomes important also for the respected leaders in the different communities to also share the same message. If you're a church leader, if you're, a community leader, if you're a political leader, whatever kind of leader you are, you need to send that message that the disease is still here with us, and we need to be careful and take care of ourselves. We've noticed that there's actually more mobility within the country compared to when we had restrictions, inter-county movement restrictions. Of course, Kenyans have been able to move. I think Kenya is a very interconnected country. We have people, trading in different parts of the counties and moving up and down. And so, yes, of course, that has contributed. Nairobi and Mombasa remain to be our hotspots. And so anyone moving from them to, different counties,
it's really a risk factor.
That's a risk factor. But then when we look at it, at the end of the day, those three measures really would be measures that would help us, flatten this curve. And it becomes also as important, as the President said, to balance between the economic effects of this and the health effects of this. And so what we are pleading, and really pleading, and that's where we are right now as a ministry, is that people should continue to sanitize, people should continue to mask.
All right. Now, still on that conversation of the breadth of community spreading and the community responsibility, what are some of those community mitigation actions that we need to do, and especially in the rural areas, that can really go a long way in helping people just make sure that we don't spread this virus further than it already is?
True. One, I would say, is that when we look at our next, should I say, response measures that we want to deploy, we're really looking at centering them at community level. And we're really looking at using, the long traditions that our country has had when it comes to mobilizing communities. How I mean, if you think about it, every time we have perhaps, say, an infection in the farm or a disease with our animals, there's always a mechanism that's innately in the community that mobilizes people, that sends out the message, and people are aware. So we want to implement that same community strategy to get in with our community leaders, who are the community champions, who is the person who is actually a thought leader and who actually shapes behavior of this community or this village. And that's exactly the strategy we're going to use, because it's very important, at that very level, that should I say, one unit of the country to be able to effect change. We're also looking at seeing, should we look at measures like masking? Should it be absolutely mandatory for you to wear a mask?
As long as you're in a public space.
Exactly, as long as you're in a public space. How do we effect such measures? How do we, beyond being enforcers, actually walk hand in hand with the community to understand that when they wear their mask, they're actually, protecting their fellow community member? And so we're looking at all those elements to see how we'll adopt that. We're looking at using our ngao structures, looking at using our administrative and ward structures so that we can be able to, have communities adhering to these measures.
All right. Now, there's one tweet that I came across yesterday, and there's one who was asking, in regards to these COVID cases, I am yet to meet someone who has contracted COVID-19. So honestly, I don't really understand the consequences of this disease because of that. Bringing into question this whole aspect of, maybe somebody might not really understand the consequences of this disease because they haven't seen somebody who has actually gone through this. It's not made public, privacy issues. We don't see the whole process from when you contract this disease to recovery. Maybe you could just paint a picture of how that process looks like to help those people who really don't have a clue of what it is understand it. So what happens is, COVID, as we all know, is a disease that affects the respiratory system. That means it's a disease that affects your chest and causes symptoms in that end. Now, what is new data is that COVID not only affects your chest or respiratory system, but affects other systems of your body. Meaning COVID can also affect your heart, COVID can also affect your brain, COVID can affect your kidneys. So it's what we call a multisystemic
systemic disease, in other words, affecting all the different systems of the body. Now, our modeling team tells us that as it stands right now, the common symptoms remain cough, the common symptoms remain fever, nausea, and a dry cough. What happens is that depending on the progression of the disease, depending on the immunity that you have as an individual, depending on your age, that you are, particularly noting that our last review of data shows us that about 50% of the 853 people who've died are over 58 years of age. So if you know you're in that age bracket, then there's a risk right there. You're at a higher risk. If you know you're diabetic or hypertensive, or
other
you have
pre-existing conditions already?
Any other pre-existing condition that affects your immunity, then you're at risk. So what we're seeing is an interesting picture that sometimes most patients, actually 93% of us, will go through the disease without knowing that we actually had it.
There was actually that report that so many people may have contracted and recovered without knowing.
Exactly. That is a possibility in the country. However, we have this 7% of us who then will get moderate disease and severe disease. And let me tell you, Jane, when the disease starts progressing to severity, it is not an easy thing. Just last weekend, I was talking to a colleague in Nairobi Hospital, and they were describing a case for me because we were trying to look at the situation. Is it escalating, and how does it look like in the private hospitals? And we have a patient, a Kenyan, who came in, talking as we are right now, but within an hour could hardly breathe for himself, and he was, trying to compensate for his breathing. So moving from, normal respiration rate, the way you breathe normally, to about 68 times in a minute. That's someone who's really trying to gasp for air and breathe. And before we know it, we had to then, of course, intubate the individual. But unfortunately, he succumbed. Within a very short number of hours, I'd say, a person who walked in, succumbed to the disease. And really, the important thing to note is, even as we say, and we are happy that the country has invested in infrastructure when it comes to oxygen and ventilators, training our healthcare workers to be able to perform those critical care services. But at the end of the day, we are seeing trends where, this disease is actually, can be very aggressive.
Yeah.
Even, in a 58-year-old, or even in some, I think 45-year-old was the other case that I saw that was quite aggressive. And so, because it's a new disease, we're still learning and trying to understand it. It should not be that difficult for you as an individual to wash your hands, to mask, and to physical distance. And I do hear you when people say they've not met anyone. And it's interesting. I think we've all seen the show known as ER, that was in our airwaves a few years ago. That show was actually, as an effect, it was actually a public health tool. It wasn't just a show. It was a public health tool that was trying to teach the people of Chicago the use of an ER. And that was put in place by the government then in Chicago when they noticed that too many people were coming to the ER with complaints that did not deserve ER attention. And so they put in that production. So this is my call to you as KBC. Perhaps you need to work with us in the Ministry of Health. Perhaps we need to almost, film what is happening and give you sort of that character of what is happening on the ground in terms of getting you into our laboratories, getting you into our wards, getting you into our ICUs.
Yes, absolutely.
So that you can see.
There's a gap there that so many people need to understand, because only those who have had or know someone directly that has gone through this can tell you that this disease is real and these are the consequences.
Exactly. So the second part of our approach will involve, bringing this closer to the citizens and really sharing with them what it means to be a COVID-19 patient and also to recover from it. We've seen cases where people are saying the recovery is not that easy. I've heard people, take from 14 to 21 days to recover. And in America, we're seeing studies undergoing in terms of second effects, that these effects may be there for years to come. That even when you recover from COVID-19, you may have residual effects in your system that affect you.
Absolutely. Now, as we bring this conversation to a close, maybe when it comes to citizen responsibility, your call to action, your clarion call, your declaration, as they say the S in the Ministry of Health, what will be your word to Kenyans this morning?
So we keep saying, thank you, Jane, and we keep saying that you are the social vaccine, and it becomes important for Kenyans to understand that in as much as there are efforts to get a vaccine the world over, these efforts are probably going to take about a year from today for us to be able to have a vaccine that we can use. And because that takes time, then we need to understand that we as Kenyans, you as the individual, you as Jane, you as Karaoke, you're the social vaccine. So put on that mask, wash your hands, and try and have spaces where you're able to physical distance. That is the call to action. Wear your mask.
wear your mask. It's as easy as that. Thank you so much. We have been speaking with Dr. Mwangangi. She is the CAS in the Ministry of Health, just here to tell us how far we have come in regards to fighting this pandemic and how further we have to go to just get to a point where we can say as a nation we are safe. All right, so and it takes you and me. It takes two to tango. So do what you got to do to protect yourself. It starts with you. At the end of the day, the community will be safer as long as it starts with you. Thank you so much, Daktari.
Thank you for having us.
We wish you the absolute best as you continue with this journey.
Thank you, Jane.
Absolutely.
Thank you so much.
All right, now we are not done with Good Morning Kenya. We have more coming up in a bit, so do stay with us. Remember, the hashtag is still Good Morning Kenya on Twitter. Our official station handle is at KBC Channel 1, and our individual handles ever remain at Sam W. Njoroge, at Ray Manyara, at Arena Range, and at Jane Wamboy. Do stay with us. We'll be right back.